So let's jump into the manual registration process. To begin that, go to Patients and go to Register a New Patient. And then the highlighted fields are required. Once you complete the highlighted fields and patient information, you can move on to number 2, insurance information. You do have to complete number 1 and number 2 before you bill out a claim for that patient. Click Add an Insurance Profile to begin that process. And then again, the highlighted fields are required. One of the very important things to point out about insurance profiles in HealthFusion is we do not allow for a duplicate profile. For example, if you have a family of 3 and the husband's the insured and the wife and child are insured underneath the husband, you're always going to want to use or search for the existing profile in the system, and we may automatically pop up possible related family members. So if that's the right person, select that insurance profile and use that selected profile. If this did not pop up automatically, but you know that insurance profile already exists, or you're getting an error message stating that that insurance profile already exists, you could search for that profile by the payer name and the insured ID number, and then you could use the active profile that's already in the system. We will not allow you to create 2 different insurance profiles underneath the same insured ID number. The next area we'll talk about is the guarantor information. The guarantor defaults to self, but you could change that with the drop-down box. If the primary insured is the actual guarantor, you could choose the primary insured as the guarantor profile. You could also choose other and manually type in the information. And again, if it already exists in the database, you could also search for that active profile. Similar to the insurance information, we do not allow for duplicate guarantor profiles. Now we'll move on to number 4, or for associations. The 2 main things that you could do in the associations area is select a referring provider, and that referring provider will default onto all claims and onto all appointments. And you could also default the prior authorization number. If you select that here, that will default onto all claims and onto all appointments. You can create your authorizations in number 5, authorizations. And then we also have an area number 6 for messages, and within the messages you could create a note. The note will only show on the patient's chart, and you could do an alert with an option for scheduling and or on billing. To pull up an active patient chart, you could use a quick search feature in the top right hand corner. You could type in a portion of the first name and or a portion of the last name, and you will land on the patient's practice management system chart. Just doing a quick review of the patient's chart, you have the patient's demographic information and their insurance information. You have links to add a new insurance profile or edit their information. For EHR users, you could give them access to the patient portal or a link to review their documents. On the right hand side, you have quick links for items such as the claim history, payments in the patient's ledger, or even entering charges. And you have a preview onto that patient AR from here as well. Below that, you have a list of all the appointments for that patient. You could even print future appointments or schedule a new appointment. And you also have access to the statement history, so you can review any statements created for that patient. Below that, you have messages for review of the alerts and notes created for that patient. And at the bottom of this screen is the authorization, so you can manage the patient's authorizations. Alright, to schedule a new appointment for this patient, you could do that right from the chart. Just click New Appointment, and that brings you to a convenient appointment search feature where you can narrow it down to a particular calendar resource, select the appointment type, and maybe the patient can only come in maybe after 2, and maybe they can only come in on Wednesdays or Fridays, and you could search available appointment types. Click on the day that the patient could come in. Click on the time button to schedule that patient, and then click Save Appointment. Another area you could schedule appointments from is right from the calendar view. Simply jump to the week view or month view. Click on the appropriate day and time. Select the appointment type in the drop-down box. From here you have an option to change the patient, so if that's not the correct patient, you could change that patient now. And there's also an option to add a new patient. When adding a new patient during the scheduling process, we do require the first name, last name, date of birth, a home phone, and a gender. Please note that these patients do not appear as a normal patient chart. These are new patients. Please review our patient roster training document for steps on how to access the new patient profiles. You could also jump into a basic or advanced view. The advanced view allows you to schedule a reoccurring appointment for that patient, so maybe they'll be coming back weekly every Friday, maybe for 5 occurrences. And then you have additional information that you could select for that appointment, episodes, box 10 information for accidents, the referring doctor and the prior authorization number. And then down here at the very bottom, you could add in any additional notes or reasons why they're going to be coming in for the visit. When you're all done, just click Save Appointment. Alright, this is a good time to bring up the recommendation to always use 2 screens at one time and make sure you're on 2 separate web browsers. So on one screen I'm on the calendar view, and then on Mozilla Firefox you could be on the daily schedule to check in and out appointments for that day. So you could be on one screen where you'll be scheduling your appointments from, where on the other screen you could check in and out all your appointments. Having 2 browsers open at one time will really help speed the efficiency of the workflow. To check a patient in, simply hover your mouse over the time of that appointment and click Check In. On the check-in screen, you could select a servicing provider for reporting options, enter additional appointment notes, review the copay and post the copay. Whenever posting payment information, you have to say the total amount collected and disperse it below. Please note we have expected amounts here for the copay, for the patient's outstanding balance, and then any patient credits, along with the guarantor balance as well. When you're all finished there, click Post Payment, and you'll have an option to print a payment receipt. When you're ready, click Appointment Check-In. And now you'll see the time of that check-in for that patient. So now we'll navigate to the EHR side, so you'll see how the calendar here reflects on the EHR dashboard. And now the doctors or the medical staff will see that the appointment is checked in and how long that patient has been waiting for. Before we review the checkout process, I'm just going to make everybody knows how to create a task or a message, and then how to review tasks or messages within the system. On the main dashboard, there are quick links here to create a new task or a new message or a chart note. And then also on every screen you're on the MetaTouch platform, just hit that little check mark box, and then you'll have an area here where you could create your messages. You could select groups that autofill certain doctors or staff members there, and then you could select the type of message that it is, tag it to a patient's chart, and then put any subjects and notes. Hit save when you're all done, and now that task or message will be sent off to the appropriate recipients. You do have a preview into your inbox. Simply click on the message or task. If it's a message and it might be linked to a task, you have a link to either the patient chart or to the task itself. From here you could accept the task, reject it, forward it, or delete it. One of the great features about this, you don't have to spend time pulling that chart, because again we do link it to the patient's chart, and then if there is any documents tied to that or any orders tied to that task, you will see that information right here, and you can link right to that data. Click Close when you're all done. Another area is your task and messaging inbox. If you see this envelope with the exclamation point, that means that you do have a new task or message, and in this area you could review all your staff messages, any patient messages, and any tasks that are overdue. This would show in red. Alright, so let's jump back to the practice management system and check that patient out. To check a patient out, simply hover your mouse over the time and click Check Out. On the checkout screen, you'll have an option to schedule a follow-up appointment, print a discharge sheet, post additional payment information, and if any follow-ups were created during the encounter process, you can review that follow-up or recall during the checkout process as well. Once this patient has been checked out, they are officially checked out, so you can navigate back to the daily schedule and continue checking your patients in and out for the day. That's it for webinar number 3. I appreciate you all for viewing the webinar today. Please write down any questions that you have while you're going through the role-based workflows and exercises. You can email those questions to implementation@healthfusion.com, or please feel free to join a live webinar to get your questions answered.